The other peptide we're going to talk about here is one of my favorites, and it's a peptide that is called tesofensine. And if you kind of look at the two big molecules right now that people are talking about when it comes to supercharging weight loss, it's tesofensine and it's semaglutide. And one of the big things that we have, and Andy, you probably see this, but when it comes to weight, one of the big issues that we're trying to solve is helping people change their behavior and change their lifestyle, but not relying completely on willpower. And so, once again, this is where we love these peptides because they can help change that the cravings in the brain. But Andy, what would you say is kind of the main willpower that people feel like they just, is it sugar cravings, the main thing they can't get over? Is it overeating? Is it
sugar cravings? But also there's quite a sense, I feel, of helplessness, of not quite knowing where to start and having been stuck in a behavior for so long. So this really helps bridge that gap because of the reduction in cravings. You know, it takes away that sense of helplessness. I feel like that's quite a common theme with people that, you know, are focusing on their weight.
Yeah, and I think so too. And I think the helplessness comes too after you've had years of struggle where you haven't gotten the results, or you get the weight off and then it comes right back and you just feel like crap, and you feel like your life has to be so darn restrictive that you can't function socially. And so this is where I've loved peptides, because they just help bypass all that psychological trauma that we go through when we're trying to make big lifestyle changes. And in many of these, you know, with peptides, there's over 7,000 peptides in nature. We've been able to sequence about 10% of those, but we're seeing more and more as the science is emerging. There's some very powerful peptides that can give you a shortcut without having a lot of the adverse reactions. So here's one with tesofensine, and this is an oral-based peptide, semaglutide or semaglutide, however you want to say that one. That can be either oral or a once-a-week injection, and we seem to like the injection more. It's about, you know, probably 60% less expensive, first of all, and it's just easy to do once a week. Now, tesofensine is just oral, but in the studies, actually, it might be something that's even more impressive than semaglutide. And so here's a 2-week study, and then we'll get into the mechanism of action. But the 2-week study, they took 203 obese patients, and what the study found is that the use of tesofensine has the ability to reduce weight 2 times more than any weight loss drug currently on the market. And so in the 6-month clinical trial, the participants lost an average of 25 pounds each. And so this is where, you know, it's been called the novel potent weight loss medicine by the Queensland University of Technology, and has shown minimal side effects. So how this one works, and it's, if you look at like AOD 9604 or semaglutide works on the GLP. It's a glucagon-like peptide. So it's working on those receptors that are found all over the body, but primarily in the pancreas. And then the tesofensine is actually working on the neurotransmitters in the brain. So this is another interesting thing, because remember, the hypothalamus is what's kind of regulating the glucagon-like peptides in the body. And so that comes from the central nervous system in the brain. Semaglutide also works on the vagus nerve, whereas tesofensine works on dopamine and serotonin pathways. And so when you're working on those pathways, what you'll start to see is your cravings for certain foods, like, you know, the greasy cheeseburger, those things go away. You don't need that dopamine rush. So, you know, Andy, you mentioned that helplessness, like, you know, when you get hungry and people are in a pattern and they say, well, you know, I've had a stressful day and I need some reward food. I'm going to go through the drive-through and get a Big Mac or whatever it might be, right? And so imagine if you could just short circuit that, and where you don't even have that thought of going through the drive-through in the first place. Would that make people's lives a little easier?
Yeah, and that's exactly what it does. You're not called to do those things.
Yeah, and the hard thing is just hanging up the phone when the call comes in, because you're going to answer it and be like, Okay, what do you got in store for me? Big Mac, that sounds really good. Chocolate brownie, I'm there. But if the call never comes through,
Yeah.
then you don't expend your energy and waste your energy on these like small little decisions that in the long run they can be detrimental to your health. And so
Yeah. Yeah. And also for someone like me that, has been as an adult, not a teenager, I've struggled with eating disorders. It took away a whole conversation, a whole dialogue in my head about food. The whole dialogue was gone. And I was like, oh, this feels so good, because I wasn't called to eat, and, I wasn't having those cravings. So it took away a lot of that dialogue around, if I did have a small treat, there was guilt associated with it, or, trying to plan what to eat and thinking about food and seeing ads on telly and thinking, oh, now I want that. None of
right.
that existed, completely gone. Was
Yeah,
awesome.
sure. Yeah, and that's the thing is you probably don't miss that friend very much, do you? The imaginary friend talking to you about food.
Well, the imaginary 10 friends, no, I don't miss them at all.
Oh yeah, we were having a party. It wasn't
There
just
was a
a.
lot of noise. There was a lot of noise in there.
That's awesome. Well, Tesofensine, if you look at the other things, the first thing they were studying this for was Parkinson's and Alzheimer's, and it was first mentioned in like 2001, where they were able to sequence these peptide structures, and then they started looking at it deeper and deeper, and they said, man, there's some things that this may do because it's working on that serotonin, noradrenaline, and dopamine reuptake inhibitor. And those are very common to have problems with in Alzheimer's and Parkinson's. And so they took it down that trial, and they're really researching it. But what they realized, like midway through the trial, they said, well, holy cow, this has a massive ability to modulate satiety and appetite. And they found that let's focus this more on weight loss, because I mean, obesity, if you think about the chronic nature of it, and 68% of Americans are either overweight or obese. John Hopkins University School of Medicine, they said, well, I think Tesofensine might do better in that camp, to help treat patients who really want to get rid of weight. And so in 2008, they started doing major studies, and the typical doses of Tesofensine is going to be 0.5 milligrams, and that's a daily dose. You can even go lower and go 0.25 milligrams, or go as high as 1 milligram. And what they found is, in compared with placebo, 12% of the, and in this study, I'll quote it, but 12% of the 0.5 milligram groups, they didn't complete the study, as compared with 29% of the 1 milligram group, and 25% of the placebo group. So 25% of those dropped out. But of the patients who dropped out of the studies, 1 mg arm, 20% did so because of adverse effects, compared with a combined average of 8% in other groups. So what they found is some of these, there may be some ill effects from Tesofensine, but usually that's where some of the nausea can be in place there. And they also found that because this is working on the serotonin and dopamine and noradrenaline pathways, be careful if you're on like a anxiolytic medication, or like an SSRI, like Prozac, Cymbalta, things like that. There can be some adverse reactions. So here's what they found in the studies, that they found that it's working on the hippocampus in the majority of the time. They also found that it worked on the peripheral pathways of dopamine and serotonin, and that it also helped in gene expression of new cell formation. So it did have some antidepressant potential. And so once again, if you're on antidepressants, this might be a problem for you. And then the other thing they found is it increased BDNF. And so if you think about this, it's like, wow, if we could get some weight off you, but also stimulate some brain-derived neurotropic factors, I mean, that's amazing. So you want to keep exercising when you're on these. But one of the things that Tesofensine, one of the reasons why I say it might be superior to like AOD 9604 or semaglutide, is the fact that it can give you a nice brain boost. And And this one was one of my favorites. I did a cycle of this about 3 months ago. And I just noticed that my brain felt a little better. I didn't lose a lot of weight on it, but maybe 4 pounds, 3 or 4 pounds. But I wasn't really going for that. I just want, I try these out just myself. I did notice more of just a lightness in my brain overall. And so what the studies show is it decreases glutamate. And glutamate's that neurotransmitter that can keep us in kind of alpha and beta state in our brain. And so when you decrease glutamate, you can get into more relaxed brain waves, decrease the synaptic transmission, and increased in neural degeneration was all stopped. And so what they found is that there was this increase in BDNF. So this is Jay Campbell, and what he says about it. He said, one of the first things he noticed was an increase in the brain-derived neurotrophic factor production, especially when he fasted for extended periods of times. My energy was higher. That's one thing I did notice on it, was fasting was very easy doing time-restricted eating. He said my energy was higher, my mood was uplifted, my focus was enhanced. Overall, the quality of my life was so much better, and I slept better too. So some great things with tesofensine. So those are a couple of newer peptides that are now just being introduced, and we've been using these very successfully. And I do find that every once in a while, having a little bit of some help with education, learning, and then with some peptides can go a long ways.